The UK government has approved a COVID-19 vaccine to be rolled out from next week. It's accepted a recommendation to approve the Pfizer and BioNTech vaccine. A committee is now working on final advice for which people should receive it first. That's expected to include care home residents and health workers. The UK Health Secretary says that around 50 hospitals are set up and waiting to accept the vaccine. Live now to London, Al Jazeera's Neve Barker is there. Talk us through this announcement. When will people be able to get this vaccine?
Well, Adrian, firstly, this is probably the most hopeful announcement since the start of the pandemic, at least, of course, since the announcement that several vaccines were being worked on by different pharmaceuticals companies and researchers in different places around the world. But it was, of course, the Pfizer-BioNTech vaccine made by that team of German scientists in partnership with the US pharmaceuticals giant that came back with initial results from key trials to suggest that they had a significant effectiveness when it came to their vaccine of more than 90%. And now the UK becomes the first industrialised nation to give the green light to this vaccine, allowing it to essentially start to be rolled out as early as next week from Monday morning, said Britain's Health Secretary Matt Hancock this morning. The MHRA, which is the Medicines and Regulatory Authority, is an independent organisation. It has basically sped up all of the checks and balances that it needs to go through to make sure that this vaccine is safe for use. Now it's all down to exactly how fast the manufacturer can make the vaccine to determine exactly how many people it can reach. But we do believe that from Monday morning, 800,000 doses will be in the UK. There need to be some checks on that vaccine before it actually leaves Belgium, where the factory is actually based, before it arrives here. People will need 2 doses of that vaccine injected into the arm 21 days apart. So 800,000 doses means that 400,000 people will receive that vaccine. And of course, also a key thing to remember, it's what's known as a key chain vaccine. So it needs to be kept at incredibly low temperatures, minus 80 degrees centigrade. And that has to be the case throughout the whole of the movement of the vaccine from one country to another, or the place of manufacture to the place in which it's actually being deployed. So the best places to receive the vaccine are, of course, going to be hospitals. But we will find out later on exactly the order of who will get the vaccine first.
Yeah, who's in charge of deciding who gets it first? And I mean, you gave me some huge numbers there. This is going to be a massive logistical operation, getting this vaccine out to those who need it.
Yeah, that's absolutely right. And determining the order of who gets the vaccine is a key one. We will find out a little bit later on when another key organisation that advises the government comes back with its findings on how exactly the vaccine should be distributed. According to Matt Hancock, the British Health Secretary, who has been speaking over the course of the morning, the British government, even prior to the regulator giving it the green light, had said that they were ready to receive 10 million doses before the end of the year. They do believe that the majority of people will be vaccinated at the start of next year. But when it comes to deciding who gets it first, well, the indication is that elderly in care homes and their carers will be at the top of the list. National Health Service workers will then get it, and then it will progressively go down the ages. So a huge logistical operation underway. Majority of people getting it next year, those most vulnerable very soon, though.
Al Jazeera's Neve Barker reporting live from London. Many thanks.